We're going to try in the veneers in such a way that we can evaluate them, but also in a way that the patient can evaluate them. So to do that, we're going to try in the veneers with a try-in paste. I will not cement veneers into place until a patient has looked at them with the try-in paste, approved them, and then gives me written consent to cement those into place. And my written consent is very simple, paraphrasing, but I've been provided the opportunity to view my veneers before they're cemented into place. I am pleased with the cosmetic appearance and give Dr. Radz my permission to cement these into place today. Date, signed, witnessed. There's a process you need to go through to treat the ceramic before you cement the ceramic into place. So we need to clean out any contamination that's on the ceramic that was picked up during try-in, and then we're going to resilonate the veneers. So, back up. There's a number of ways that you can clean out the porcelain. In the old days, I would use phosphoric etch, and I'd put that on the internal aspect of the veneers for 30 seconds. And not to etch the porcelain, because phosphoric etch will not etch porcelain, but phosphoric etch is actually a really good detergent. So I would apply phosphoric etch, internal aspect, 30 seconds, rinse and dry. The other very commonly taught technique was put all the veneers in isopropyl alcohol in the ultrasonic for 90 seconds. Either one of these still works well. After I've decontaminated and cleaned the internal aspect of the porcelain, the last thing I do is resilonate the internal aspect of the porcelain. For cementation, we need to isolate the area. We're going to acid etch it. We're going to use bonding agent, obviously, and then we'll talk about the cementation. The other important thing I left off on this slide is before I isolate, I go back with my pumice and the hemoseal inside, and I clean the preps one more time. And after I clean the preps, I'm checking to make sure I've got no hemorrhage. And if there's any hemorrhage, I'm using my hemostatic solution or my hemostatic paste. And that has to be totally controlled before I go to cementation. Isolation can be with a rubber dam, frequently taught clinically. Not a lot of us do it. It's hard to do. I isolate using orthodontic retractors 90% of the time.